Hello, I'm Dr. John. Welcome back from Gonstead Physical Medicine. Today we're going to talk about neuropathy. So what is neuropathy? Neuropathy is basically nerve damage. And when it occurs in the peripheral nervous system, it's called peripheral neuropathy. So let's go take a look at what's going on in the central nervous system. So the central nervous system is basically the brain and the spinal cord. Everything outside the spinal cord is called the peripheral nervous system. So the nerves that go to the hands and the nerves that go to the feet. So what's occurring is the brain sends messages down through the spinal cord, out through the peripheral nerves, down through the leg to the foot, and it activates the foot to move. Now, that works in the other direction. So if you step on a hot coal, for example, the receptors in the foot is going to send information back up to the peripheral nerve, through the spinal cord, up to the brain to pull your foot away. Now, neuropathy mostly occurs in the hands and the feet because these are the longest nerve extensions from the spinal cord. So the longest ones are the feet and all the way down to the hands. They're longer nerves, so they're much more susceptible for neuropathy. Now, what is neuropathy? Like I said before, it's the degeneration and the dying off of nerves. Now let's go take a look at a model of a nerve. This is a model of a nerve. It's basically like a telephone wire because it transmits signals in the form of electrical impulses or nerve signaling. So what's going on here is this is the part of the nerve called the axon, and this white coating is really, really important because this white coating is called the myelin sheath, and it's how nerves transmit messages or nerve impulses or signaling is conducted along the myelin. Now, when the myelin gets degenerated or it starts to deteriorate from inflammation and nerve damage, what starts occurring is the nerves can't transmit the signals correctly, and then you will start to develop the early symptoms of neuropathy. So what are the early symptoms of neuropathy? Well, the early symptoms of neuropathy is basically tingling, burning, pain, and numbness in the hands and in the feet. And as that continues and gets worse, as it starts degenerating, the myelin starts to get worse. You can see the indentations of the myelin compared to a normal nerve where it's nice and full. What will start happening is paralysis. So you won't be able to move the fingers as well, or you won't be able to move the toes as well. And sometimes you'll get something called a trigger finger where the finger will get stuck and you can't put into extension. Or you'll create paralysis in the foot and you'll create something called foot drop where the foot actually drops and you can't raise it up. Now, as neuropathy continues and the nerve starts to deteriorate more and more, what will occur is, especially in the elderly people, is that they can't feel the floor. They lose their ability to feel the floor and sensations. And what happens is we see lots of falls because they can't feel the ground, they will trip. We see lots of hip fractures and broken arms and things like that because they can't feel the floor. Now, as neuropathy progresses, and if you have something called diabetic neuropathy, what happens is the elderly people will start developing wounds on the bottom of the feet. And once that happens, it gets really serious because infections can set in. And in worst case scenario, we have seen amputations on the toes, on the ankles, and the foot. So if you have neuropathy, or if you have any of the signs of the symptoms of neuropathy, you want to get that diagnosed and treated as soon as you can because that will progress and get worse. I'm Dr. John. I will see you in the next video.